Technology in healthcare, from the world's oldest prosthetic devices dating back to 950 BC, to the first computers in hospitals in 1980, to artificial intelligence potentially revolutionizing medicine soon. In this podcast, we're going to get real about healthcare and explore how technology has helped and hindered medicine. Here's Robin Wiener.
Hi everybody, welcome to our podcast today. I'm so excited to be joined today by Jennifer Bowers, who was our very first guest on Get Real About Healthcare. Jennifer Bowers is the Vice President of Clinical Insights at Get Real Health, a global health information company pioneering specializing in patient engagement and connected care solutions. Before working in healthcare, before working in health technology, Jennifer was an oncology nurse for 22 years. Her in-depth experience in the front lines with patients bring invaluable insights to developing technology that will improve the user experience for patients and healthcare providers alike. Jennifer is also a cancer survivor herself, so her personal experience drives her to improve the nation's healthcare systems. Jennifer, thanks for being our very first guest on the Get Real About Healthcare podcast. We're super excited to have you here. So to make this fun and make it interactive, I'm going to have a series of rapid questions for you, so we all can get to know you a little bit better and get a feel for who you are and some of the funny things a little bit about you, what you like. So you have not seen these questions before, so this is going to be fun. So this is an easy one. Just going to throw out an easy one. What are some of your hobbies?
Well, I like to be active. I like to cook. I just took up golf. Recently got my first birdie on my 9th time out, which was pretty exciting.
Fantastic.
But really, cooking for my family and hanging out with my friends are my favorite things to do.
That's great. That sounds like a lot of fun. Definitely need you to cook for me someday.
Anytime.
What are you reading or listening to or binging right now?
I just finished Where the Crawdads Sing.
Ooh.
And in fact, I bought it with you. We were out one day. And I didn't know anything about it going in, which was kind of the best thing about reading it. And I happened to be at the beach, and it was a perfect beach read.
That's great. That's great. Are you going to see the movie?
I'd love to.
Sounds like a plan. Okay, I know you're going to love this question. If you could have dinner with any historic figure or current celebrity, who would it be?
Bill Clinton.
Wow. And why Bill Clinton?
Bill Clinton, before I met my husband, was my celebrity crush. And I've been involved in politics since the day I was born. I always say that I went on literature drops before I could walk and licked stamps before I could talk. And politics has just always been very, very important in my life and in my family. And he's a Georgetown grad like myself. And I did get to meet him a couple times, but didn't get to have any in-depth conversations with him.
Well, you kind of combine both of them because he's a celebrity and historic figure, so that's a kind of cool combination. Now, this you have to think a little bit. What would you like the world to look like in 5 years?
I'd like the world to look cleaner air, cleaner water, cleaner food sources for everybody to eat. I don't think we'll be there in 5 years, but I'd like to see us moving in that direction.
I think we all would, really, and maybe help with the weather a bit,
yes.
Right?
There is a connection there.
I believe that the hurricane forecast just came out, so that should be quite interesting.
Excellent.
Take a look at that. So I just want to kind of get into some of the things we're going to be talking about in healthcare and how healthcare technology is really making a difference. And you've been in it for a while. You've been on both sides of the house. You've been in it with patients, with providers, really working with all this. And then you get on the other side of the house where you're actually working on technology. So why would you do that? Like, why would you go from being you have a very long career with helping patients, oncology nurse, which is such an incredible gift to the world here. Why would you jump over to a healthcare technology company?
Well, that one's easy, Robin. Your persistence is what brought me into technology. It wasn't even on my radar. I loved the work I was doing. I loved being a bedside nurse, working one-on-one with patients. And in fact, I had great relationships with some of my patients. When I was diagnosed with cancer, I had my patients reach out to me and say they'd come to my appointments with me. So I really loved what I was doing. And then my son started kindergarten with your son, and we met.
Yes.
And for a couple of years there, you just kept telling me about this company and about the tool, and you were just so excited about it. And I wanted in. I wanted to try it. I was scared to death. So I came in, just started one day a week as a consultant, and I realized that instead of touching one person at a time and affecting change in one person's life, we can do that to millions of people at the same time. And that's just really, really powerful.
Do you feel like you're doing that?
I absolutely do. I get so excited about the numbers of people that we're reaching out to at this point. It is amazing what we can do with our technology.
When you talk about our technology, can you describe what we mean by our technology?
Yeah.
What is, we talk about healthcare technology all over the place. What do you do, and what area are you focusing on, and what kind of technology are we talking about here? This is our first one out. Our viewers don't really know what we do, so maybe you can describe you also run the product for the whole corporation. So go ahead and tell us a little bit about that.
Yeah, absolutely. So our tools empower patients to not only see their data, which there are a ton of tools out there that allow patients to see their data. Everybody has multiple portals that allow them to see their data from one specific provider, one specific hospital system. What we do is help to give patients insights, help patients to understand their data, just the way we present it in a very friendly manner. We give patients some choice as to how they want the layout of their own particular site to look. Not just the clients, but the actual patient can say, these are the tools that I use every day, so this is what I want to see when I come in. We can get a lot of education to patients to really give them context around their healthcare.
Do you think providers, we hear a lot that this all sounds great and we have all this technology, but do the providers really want that? Do they really think it's important? Is it really changing the dial to them?
Yeah. This has been really slow in the coming. Providers are very reticent to see that at-home data, and we still see this. However, the healthcare landscape has changed so much with COVID that providers are treating and seeing and managing patients that they've never met before and may never meet in person. So they need more insight. We have started to recognize that really most of the care happens at home. And as long as we keep the lawyers happy by saying, I may not see this data, and I think that's what people are afraid of, is they're afraid they'll be on the hook for something that they don't pick up that comes in that data. But as long as you're open and honest with the patients, they understand that.
Well, how were you doing it before this, when you were a nurse, an oncology nurse? Because this is, we're looking at what was and what could.
Yep,
right?
Yep. So in my particular instance, I ran multiple different research protocols in breast cancer. And the data at home in research is key. Patients either stay on studies or get kicked off studies based on how much data they bring in on about what's going on in between the treatments. It should be like that in all care, but it does happen in research. And I'd give them a paper calendar and say, go home and write down your symptoms every day. Well, my patients were sick.
Right, absolutely.
And nobody feels like pulling out a piece of paper. But you know what they do, even when they're sick, is they're on their phone. They're, doing little puzzles and looking at Facebook, because that's easy chunks of things to accomplish. So if you can give them those questions about how they're feeling at home in their hand, they're much more likely to be able to answer
And how
that.
did that change the care that you gave them?
So the people who came in, so we dose chemotherapy based on a lot of things.
Right.
Height, weight, number one. But number two is on how they were affected in their last treatment. If they come in and they tell me they didn't eat for 3 days, they were sick so they couldn't eat, or they had blisters on their feet, we would adjust the dose. But what we find is that patients were so sick during certain periods of time that then when they feel a lot better, they kind of forget how they felt, and we miss that. And then we give them the same dose and the effects are double, or much worse.
If I'm looking at the product we sell here at Get Rare Health, I would look at that daily living.
Oh yeah,
so,
it's a perfect fit.
Yeah, we have a kind of a survey daily living that you can just click and be able to do it. So that you can actually almost see at, they wouldn't even have to come in. You could look at that online and make really informed decisions.
Yeah, not only that, but going back to the research again, there are certain things that you are on the hook for reporting to the company, the pharmaceutical company, or whoever's doing the research. And if you don't report that, you can have some significant penalties. And if you don't know until they come in and they tell you what's going on, you may have missed something. You may have already missed the deadline when you were supposed to report it. I know it seems crazy if you didn't know, but it is the way it is.
Yeah.
So being able to be notified, being able to be alerted, if I could come in and have a dashboard in front of me that showed me any patients who had triggered alerts, that would have made my life a lot easier.
And that's good. I think a lot of people, what we see out there, they can understand the patient side of it and now understanding the provider and actually engaging that patient. And I think you brought it up a little bit about having it be mobile first and making sure it's in their hands, it's reminders, those kind of things. Because one of the things people say, are they going to adopt it? Are they going to actually use it? Mm-hmm. Is it really making a difference? And it sounds like that's exactly what you're hoping would happen, especially for somebody who's sick.
Yeah, absolutely. And one of the things we talk about when we talk about patient adoption and such is, with something like this, we will never see 100% adoption, and that's okay. 100% of people don't need to use a healthcare app. At some point in their lives, they need access to use it in a one time if they're injured or they're sick, or they just need to see their routine labs. But we really need to make sure we're targeting those people who need it the most with tools such as a daily living survey.
So I know how many years have you been at Get Real Health now?
9.
9 years. So when we started this you were here 9 years ago, we started building this. It took a long time for people to come. So tell me a little bit about why it took so long for people to understand what with technology, how it could help, and did we build the right things? Did we have to make changes? Talk a little bit about that journey as you went through that.
We were definitely ahead of the curve. And I think one of the reasons we were ahead of the curve still continues to be an issue, which is the data and being able to access the data. Currently, our system is set up with patient portals being attached to specific EMRs. And that's the only data.
And the EMR for everybody out there is
an electronic medical record.
Yes.
It's a good thing I knew that.
Yeah. Well, I would hope as a nurse you might have used one once or twice.
Exactly.
Yeah. Mm-hmm.
Exactly. And so a patient goes to hospital A or doctor B, and they have a different experience with each visit or with each encounter in the healthcare system. What we went out to do was to bring all that data together. Well, the EMRs don't want to share and haven't wanted to share. And although that has slowly changed, we're not there yet. In order to get true interoperability, getting everybody's data in one place, everybody has to open up their doors and let that data flow. One of the other issues that we've seen that we don't necessarily see outside the US is that we don't have a usable national patient ID to connect, because what's really important is making sure the right patient is connected to the right data, and that is key. That's a huge privacy thing. Outside the US, every other country we've worked with has a national ID, and so it's very easy to get that patient connected with the right data. We don't do that here in the US. So although the data flow has changed a little bit, I think we need to get a little more creative on how we might incentivize the EMR companies to open up that data for everybody.
And it's not just EMR companies. I would think pharmaceutical companies, labs.
Absolutely.
The power is in the data.
And everybody wants to own their own data, but imagine if they were incentivized or payment depended on them opening up that data to everybody so that that data flows.
So that data is great for the patients and the doctors. What about, you talked a little bit about the research studies and being able to get people into clinical studies.
Oh, yeah.
We live here, of course, in the Washington, D.C. area, and we are blessed. And NIH, 2 metro stops from our office here in Rockville, Maryland. Or we've got one of the best hospital systems in the world, Johns Hopkins down the road. What happens to that patient in the middle of a small little town in Iowa? They're isolated from the rest of this going on. How do you think this data and these systems would actually help them be recognized and get involved in something like that?
Oh, it would be amazing. Patients in rural America, patients who don't have access to the systems that hospital systems and research arenas that we have here, aren't getting put on the studies. And that's bad for a lot of reasons. Number one, it's bad for the patient.
Absolutely,
because
yeah.
they're not
It's not fair.
necessarily getting the best care.
Yeah.
But it's bad for the research study. And the research study needs data from all walks of life and all regions to try to figure out, maybe they find a pocket of people who have all the same disease and they can figure out why that might be. We saw that in Long Island many years ago when so many people showed up with breast cancer. So, that would be absolutely key. Now, how we can do that is by opening up that data and having everybody share it, because the pharmaceutical companies who are doing those research protocols could just mine that data, find people with certain diagnoses and reach out and say, hey, we've got this study that might fit. Would you be interested?
And you can do that securely by asking the patient at the beginning of consent to say, would you be interested in a research study or a clinical study? If, and you say yes or no. If you say no, nobody would ever reach out to you.
Yep.
But if you said yes, then we can actually have people to reach out. And I think that's really powerful. I think about, we are blessed, we're here, we're right in this location. So not only for the, we do, since we work together, we do work all around the world, but how interesting is when we start with this data and these data studies that go in and see what trends are happening and what is working maybe with a new drug in Australia that we don't even know about in this same kind of piece, that we can bring these medications, making this one large world. I mean, would that, as a clinician, that would be so powerful for you.
You're certainly not a dreamer at all, are you?
No, I dream. I always dream. What can I say? I'm hoping for the best, right?
I would love to just get this in the United States first.
Yes.
But of course, and with the power of, frankly, Unify, our most recent product, we could put the whole world on one database. It would be pretty incredible. There's a lot of barriers with security of different countries and being able to share data from country to country, but think about the power of, and the healing power of that, and the treatments and medications that we could get out all over the world.
This is where artificial intelligence really comes in and starts to really do, and people get worried about that, but it's really about the power of actually helping people. I know when we started the company back in the day, our mission was to actually do something to help people.
Yeah.
And I think that's what pulled you in, right?
Absolutely, no question. And we are definitely seeing the fruits of that labor at this point. We are developing new items into our products so rapidly now that I go in sometimes and I was like, wow, I didn't even realize we'd done that yet. We have gotten to a point where our development cycles, we're getting so much done and so much more into the product that we can now touch that many more people. And we're talking millions of people. We can actually say that now, millions of people. And it's very powerful.
And I look at the, so we talked a little bit about what we do here at Get Real Health, but industry-wide, are you seeing a change in the industry just, with COVID? Let's talk about COVID a little bit, right? It's been a tough 3 years, and it's still going on. So when we talking about bringing the databases together and the world together, something that really has changed in our world, the way we do medicine has changed.
Absolutely.
The way we do everything has changed in the last 3 years. But one of the biggest things we've seen, and this goes back to the research studies and having this data, is the introductions of real telehealth and remote patient monitoring. And I think that's something that is very, very different. But because of that, I do feel like technology has leapfrogged a few years and be able to do it. So let's talk a little about the telecom side of it, the telecommunication, be able to do that piece of it, the telehealth. But also, are you seeing other technologies outside our organization that you're kind of going, wow, that is cool?
Well, COVID's changed everything. And it's done a couple of things in our industry for a couple of reasons. One is that we've had to be able to reach out to patients where they are. We've had to get very creative with how we manage patients, how we treat patients. And we've done that for a while strictly through video conferencing. It's amazing. I've had a dermatological exam via video conferencing. Imagine that. That's not something anybody even dreamed of doing before COVID. But the technology has had to keep up. And in order to do that, technology has had to get very fast. Yeah. And I think the other thing that COVID has changed is the fact that we can work from home, we can work from wherever, making people more productive. And we're now more accepting of people working from wherever. which makes them more productive, so that we can continue that working very fast and keeping that going.
I'm just going to take it thought a little bit on that. Is we have the great resignation right now going on, and in the healthcare world, we are seeing people, they're burned out. I mean, what they did for all of us during COVID is they're basically heroes and being in there, but they're exhausted, they're leaving. How can the telehealth maybe actually can have people maybe not have to go to the hospitals, but how does that work for somebody who maybe wants to pull back a bit as a doctor or a PA or a nurse?
Before COVID, we never really thought about having the ability for nurses to work from home. And in fact, I said that I was a single mom. If my son was sick, it was really hard. I couldn't work from home. Can't bring my patients home with me. But what we've seen now is we can give nurses the ability to actually work out of their house, because we've now become very accepting of being able to treat people over the phone. Call centers, video conferencing centers, they can be anywhere. They don't have to be in a centralized location. So if nurses want to step away from the bedside, there's a whole new field that they can step into, which didn't exist before.
Right, and that actually, so if people need to take that break, they can do that, work half days and et cetera. On the technology side though, let's just take telehealth. When that first came out, it was kind of grainy and it was not very, have you seen a huge advance in that kind of software? Because we're really talking about software here.
Absolutely, and that is definitely outside of our industry. The ability to get really clear cameras. And of course that was available to people on television, people in the movies, but it wasn't available to people like me. In the beginning of COVID, I bought myself a camera for my computer, and I think at this point it's probably like 1/8 of what I paid for it in that short of a period of time. So the technology has gotten so advanced that the same tool that works just as well is now available to the masses, where it wasn't before.
But it's great doing the video conference. Talk about a little bit of how you can use third-party applications or devices to be able to monitor that patient from there, and how it feeds back into a digital front door like we have, our patient portal.
Yeah,
how does that all work?
Absolutely. So really in any use case, whether you're checking somebody's blood pressure at home or checking their blood sugar at home, you can use these devices that either you already had that you're using at home, or that potentially you are now purchasing, or your insurance is now covering a lot of those things. Within our tool, at least, we can connect those devices and bring that data in. We also can send tasks for patients to do, so that they remember to do these things, and they know it's time to check their blood pressure. And all they have to do is use the cuff that they're using in order to do that, and that information can feed back. If we look at a use case of congestive heart failure, which used to have huge percentages of readmission rates when people left the hospital. So they'd have an acute episode, they'd leave the hospital, they'd go home, follow up in 2 weeks. But there was no interaction between that 2 weeks, no way to know what was going on. If we could put a blood pressure cuff and a connected scale into their homes, we could reach out and intervene if their weight went up. So in congestive heart failure, it's very important to know if somebody's retaining fluid. And if they could just stand on the scale, that information could feed in, could trigger an alert, and allow someone to reach out long before they'd ever come in, to reach out and maybe just do a little tweak to their medication instead of having them back in the emergency room a week later.
Wow, it seems like it costs a lot, does it?
No. So a couple things there. Again, with the technology of things like connected scales and connected blood pressure cuffs, the cost of those things has come down immensely. In addition, because of COVID, insurance companies are now looking at covering, or are covering, some of these things, because they know that it's cheaper for them, because that's what they're looking at, is allowing them to be able to get that information in between the visits.
So talking a little bit about, maybe, does it get you frustrated that people aren't using this stuff yet?
Oh yeah, this tool is my baby, and you want everybody to see and love your baby.
Yes, we do. Absolutely.
Yes. And again, a couple of issues. Number one, we're still ahead of the curve. Number two, we still have data blocking. Absolutely no question. Number three, the other thing I mentioned is that we don't have a national ID to very easily connect people to their data. The tool is there, and the tool is ready and can do the things that we want it to. We just need the other systems to kind of open up and share.
So we talked a lot about the U.S. Let's talk a little internationally.
Yeah.
Why do you think we see a bigger pickup in some of these other countries? You know, we've got over 2 million people using the product up in Canada. We've got 500,000 using it in Europe. Mm-hmm. Talk a little bit about why you think, even past the national ID, of why that might be more of a focus inside those countries.
Yep, absolutely. So outside of the United States, the governments are generally on the hook for the bill.
Right.
So they're providing this information, or providing these tools. In the US, it's individual hospital systems, individual clinics providing this information. Patients don't have necessarily that trust or that loyalty to these individual organizations to say, oh yeah, I'm going to sign up for that. But overseas, it's the government, and they're saying, this is how you get your health care. It's a trusted entity, and their goal really is to improve patients' health to keep down costs. That is the goal for each individual insurance company here, but there's no there's no connection between all of that.
And lowering the costs in those social medicine countries is going to actually lower the costs in your taxes. It is a complete drop into that. Yep. So I think that's really important. Do you find patients and doctors to be different in other countries versus here in the U.S.?
I think it depends on the country. Mm-hmm. I think from what we've seen, patients seem to be more engaged in their healthcare elsewhere, and truthfully, in some of the countries, more interested in wellness than we are here in the United States.
But people are people. They always amazes me as people say, "Oh, we're very different here in the U.S. from the other places." No, they also have diabetes, cancer. You know, they are very similar to what we have. So we're able to solve problems across, and I think that's a really big piece.
I mean, the bottom line is people want to feel good, no matter where you are in the world. And in order to do that, health is very important. So that is a very big common denominator.
So let's talk about your own health and how, I mean, you've gone through your struggles, and some of the roadblocks and things that happened to you might have been prevented if we had better health care here and stuff. And not only just on your physical side, but also mental health wise, which is a massive problem around this world right now, is the mental health side. So let's talk a little bit, if you don't mind, talking about your journey and through the healthcare piece here in the United States, and where technology helped and technology maybe didn't help, and maybe a little too hands off. So because there is a fine line that we're talking about here. We are all about technology and stuff, but that interactive with the actual person is so important. So if you want to walk us through your journey a bit, that would be great.
So mine is unique in that I have 3 dermatologists that I see and 2 different oncologists that I see, and they're all in different health systems.
So you had skin,
yes, a stage 3 melanoma.
Yeah.
And had quite a large melanoma removed from my back, and needed to get immunotherapy for it for a year. Ended up.
Can you explain what that is?
Oh,
yes.
Yes.
So I always have to remind the nurse that we're not all of us are nurses or doctors or clinicians. Or we're just kind of going, what?
So whereas chemotherapy kills your cells indiscriminately, just kills your cells, get the cancer cells at the same time, but you get pretty sick. Yeah. What immunotherapy is that it triggers your body to do the work, and it triggers your body to go after the cancer cells. And it's pretty cool because there's many fewer side effects. Unfortunately, one of the side effects is it can give you autoimmune diseases, and I ended up with an autoimmune disease because of my treatment. Hence, my 3rd dermatologist that got added to the team. But what I found is that my doctors don't communicate. 2 of them did very well, but we're talking 5 different physicians in 5 different health systems, and that's the good and the bad about having all of our choices in this area. I see some people at Hopkins, I see some people at Inova Fairfax, 2 huge medical systems who both happen to be on the same EMR. I won't name names, but it's pretty big.
You could almost say it's epic.
You could say that. And you did. And it's true. And they don't speak to each other. So I know how the system works. So I knew that I had to get paper copies and that sort of thing to bring to each. I kept a binder. This is the thing we're trying to get rid of. This is the thing that we've been trying to get rid of for years, is that binder. But I still felt, I had my own instant PHR account where I uploaded everything, but not everybody has that ability, and not all of my providers could access it. So I would still have to bring in paper copies. But I can't tell you, I would go into one doctor and they'd do a CBC, and I'd go into another doctor and they'd want a complete blood count, blood test. And I'd go into another doctor and they'd want to do the same test. And I'd say, well, I had one yesterday. And they'd say, well, I can't see the results, so we're going to have to do it again.
What a waste of time and money.
Yes. And needle sticks.
And needle sticks, yeah. You mean that wasn't comfortable? Okay, yeah.
I had quite a few of those. I learned an awful lot being on the other side of the fence about what my patients struggled with also. It was very interesting. But, you know, just being able to gather some information about medications and that sort of thing is so key. I happen to know where to look. I happen to know where to research things. It gave me so much more insight into what other patients who don't have that access.
If I remember correctly, you were able to, when they put the report down, if you had cancer or not, you read it before the doctor told you because you understood it.
That was when I had my lymph nodes tested, and I was sitting there with the doctor on one side of me and my husband on the other side of me, and he put it down upside down, and I know exactly what it looks like, and it said 2/3. I knew they tested 3 lymph nodes. I knew then that meant I had 2 positive out of 3 lymph nodes. And I just started crying, and the doctor and my husband were like, what just happened? And I said, I read the report upside down. And yes, so that is very unique to me.
Right.
But
I can go back to, as everybody out there probably figured Jen and I are really good friends. I went to some of your doctor's appointments, and even as a nurse, it was overwhelming. You would get pieces, and I, being, you know, that I've been on this journey with you the whole way, I was able to say, no, Jen, that happened on this date, and this happened on this date. So that is even more frustrating as you're a nurse and you understand the power of it, but having to not have that information handy, that you had to go back in your memory and try to remember. And guess what? You're on a lot of different medications, and you're not going to remember those little details. So that,
not only the medications, but it is just, as you were saying, it is so overwhelming.
yeah.
And maybe even a little more so for me, because I knew exactly what it all meant, and there were points where I wish I didn't know so much.
Yeah.
Which was the great thing and the bad thing. And it's true. You need one repository for everything, and there's so much that goes on. There's so many tests. There's so many conversations that you have. And I'll say this still. In the EMR systems, when you look at your report from a visit, there's nothing in there that tells you anything that happened in a conversation. What it says is everything that's pre-populated. It's automatically told to pull your blood pressures in, pull your lab tests in, and generally some content that is automatically pre-populated. But there's nothing about your true instructions and what really happened. So unfortunately, it's still key to have friends like you to come with you.
Absolutely. I mean, and you do the same for me on our side. But I think when you start looking at it, and even here, just in the Washington, D.C. area, you named 2 of the largest hospital systems, and them being on the same electronic health record and not being able to talk, is that frustration. And that is where we really push on being able to have a system-wide way of technology to be able to read back and forth and be able to do, and bringing that daily living, because some of the questions they were asking you that I had to bring up were daily living questions.
Absolutely.
When did this rash started, or when did this happen here, and be able to have that piece. So it really, you being on the other side of but for us here at Get Real Health we're very sad you had to go through that journey, and we're so happy that you made it through and you're healthy and everything, but you really do bring a whole different insight in why this is important. Mm-hmm. What did that teach you in that the last 4 years of this journey? What does that teach you about what you need to be able to do here, Ashley, or really anybody out there in the technology, because we're talking to other technologists out there? How does that real world experience influence you on what you're doing every single day to make technology, not just at Get Real Health, technology across the industry, easier to use, bringing the right data together in a format that patients and citizens and clinicians are able to use in a way that's easy.
We need to get very creative as an industry to make sure that we are flexible and not concrete on saying this is the one way we're going to do everything, because if you say that, you're not going to meet a population. We need to reach patients where they are, which at this point is still a lot of them in their homes. We need to, I think we've finally gotten to the point where we're looking to accept that we need that data from inside somebody's home, and how important that is. We've said for years, 99% of care happens in the home, only 1%, and it's probably more happens in the home and less in a doctor's office for the average person. But we've been saying that for years, and I think people are finally realizing, how important it is to get that information and to be able to have patients have a connection with healthcare where they are, not where the provider is, and have it be much more patient-centric, which is what we've always done.
So if I go back to what would you like to see in 5 years, but in healthcare, what would you like to see in 5 years? And we know we want the world to get healthier. We want, we all climate change, all those kind of things, be able to breathe air and eat food that is healthy for us. But if we were focusing on healthcare and health technology, what would you like to see in 5 years?
I would like everybody to be able to have in their hands all of their healthcare in one place, have some context around it, some way, if you're not a nurse, to understand what you're looking at. And I want everybody to be able to carry that with them and have healthcare come to them instead of the patient having to go to healthcare.
And how would you include the family in that?
Well, that's another really important thing, is that we all manage our family's healthcare. And, by putting it in the patient's hand, you give them the ability to share with whom they want. My mother lives in Boston, and she gives me her logins for her patient portals so I can see her healthcare. That's not the way it should work. She should own that and be able to share it, not just the username and password, but share the account so that we all can see the things that are important to help each other.
Absolutely, absolutely. We've talked about a lot of different things today. What haven't we talked about? What things you might want to bring up? Thoughts you have about what you do every day? Would you ever like to practice again? Those kind of pieces. What other thoughts might you have?
I don't know about the practice thing. I go back and forth on that quite a bit.
You do take good care of us here at Get Real Health.
And I really, that is absolutely how I practice these days,
Yeah.
is I get to help my friends and my colleagues, at least advise. I think the important thing that everybody needs to understand is we are definitely moving in the right direction, but truly patients and everybody, people, not just patients, because people are patients, have to be in control and have to drive where we go in healthcare. And I know that's starting, but for so long, physicians, insurance companies, pharmaceutical companies have made the decisions for patients. And they're those are three very strong organizations, and they are organizations. Patients are finally getting their voices heard. They know that they can say, you know what, you don't give me the right care, I can go to a different doctor. And they have choices. So I think that's one of the important things that we need to realize, and that patients are going to really shape where we go from here.
Put the power back in the patient's hands.
Absolutely, no question.
Yeah. Well, this has been incredibly great to sit down and talk to you. And just kind of talk about your journey in health IT, your journey in healthcare, and then your personal journey. Really, thank you so much for sharing that with us today. We're excited about the future and where we can take all this, and hopefully have a healthier world for us, our children, and someday grandchildren.
Oh my goodness.
Woohoo! Yes. So thank you so much, Jennifer.
It's been great. Thank you.
Thanks for everybody for joining us, and please come back and visit us again at Get Real About Healthcare with myself, Robin Wiener. Thank you again.
The Get Real About Healthcare podcast is a production of Get Real Health. If you want to hear more of our interviews with top healthcare and technology innovators in this industry, be sure to follow us on social media at Get Real Health and subscribe anywhere you get your podcasts.